nataka kuambia watu ya Uasin Gishu, tusipojihadhari tutaondoka kwa hii dunia haraka, kwa maana ugonjwa wa COVID unaenea sana katika Kenya na katika kaunti yetu, na hii ni kwa vile tumeregeza zile amri ambazo zimetolewa. So we need to be very careful. Maagizo ambazo tumepewa na Wizara ya Afya, watu kutokusanyika kwa vikundi, watu kuacha kusalamiana kwa mkono, watu kuvaa barakoa, watu kunawa mikono kutumia sanitizer ama sabuni kwa sekunde 20. Haya yote yanampangilia kuhakikisha kwamba sisi tunaweza kuepuka na maradhi ya COVID.
We are requesting that we work together to contain and to curb the more spread of coronavirus. If we continue that way, the way we are, this disease is going to spread further. And we know, we have seen the trend rising. We have several patients on home-based care as a county, and we have others in our health facilities. At the moment, we have our Kamalel and Elgeyo border admitting clients. We also have MTRH and the private hospitals. We have seen the rise in the numbers and the severity of the illness. And we really are requesting that let each individual take a personal responsibility so that we can be able to contain further spread of this disease. At the moment we have space. I wouldn't say that we don't have space. We still have space at Kamalel. It is not full, and even Elgeyo border, it is not full. The trend is just worrying that the numbers are increasing. If the numbers increase, that is now what will happen, that we shall be overwhelmed in the hospitals, just the way we saw hospitals abroad being overwhelmed. So really we must take very serious action. We must take personal responsibility. Let us really minimize the spread of this virus. It is possible if we continue adhering to the protocols that were given by the Ministry of Health, if we continue washing our hands with soap and water for at least more than 20 seconds regularly, we minimize social contact, we keep the social distance as required, 2 meters apart. Let us avoid overcrowding. Let us avoid being in very many social functions. We have seen even in churches. We have had some churches not following the set guidelines. You find that they are overcrowded in church. It is like back to normal. We are really requesting that all sectors follow the protocols. Even the hotels, the bars, the markets, we find that people are not taking the precautions that had been provided.
Actually, what the Center for Human Rights does is that we enable the indigent community to access justice. But, Your Excellency, the DG, we realize that we cannot enable a sickly county and a county of dead people from corona to access any justice. So we realized that there was need to support the county in the fight against COVID-19, and we are really pleased with the efforts Madam C's Health is putting in place for the county members to survive and to fight the pandemic. The efforts being put in place by the county government, led by the executive in fight against COVID-19, and that's the reason that we thought our hand will also make a difference.
Otherwise, nasema asante kwa zile vifaa ambavyo tumepewa, tutatumia kwa njia ambayo itakuwa ya manufaa kwa watu ya Uasin Gishu. Sio mingi, lakini itasaidia mahali pakubwa.
Naenda kuflag off wale wa kutumia bodaboda wakiwa na reflector jackets ya kufundisha na kuelimisha watu wetu. Makofi mazuri kabisa ya kwamba tutaendelea kukumbusha jirani mwenzako tukomeshe corona ili tuwe na Uasin Gishu COVID free county. Asante, Your Excellency. deputy governor wetu, asante waziri kwa kazi nzuri, asante washikadau katika sekta ya afya kwa kazi nzuri, Center for Human Rights and Mediation ni CBO kwa kaunti yetu, ni kumaanisha unaweza kufanya kazi nzuri kwa kiwango chochote kile.